Hello everybody, I'm Judith Castilleja and I'm talking about COVID-19. Everyone can do something to mitigate and contain the spread of disease. The first thing is always to understand what they are, how they are transmitted, and how they affect us. In this case, it is coronavirus. It appeared in China last December and caused a disease called COVID-19, which spread around the world and was declared a global pandemic by the World Health Organization. There is a lot of information about the COVID, some true and some false. We will expose some questions that will help people to understand a little more about this new virus. What are coronavirus? Coronavirus are a family of viruses that cause illness ranging from the common cold to more serious respiratory diseases circulating among humans and animals. The best known are severe acute respiratory syndrome and middle-aged respiratory syndrome. The new coronavirus SARS-CoV-2 cause COVID-19, which can lead to mild to severe illness in people around the world. How does the new coronavirus spread and infect? It can be spread from one person to another, usually through the air, by coughing and sneezing, by close contact with infected or sick people, or by touching an object or surface with the virus on in and the touching your mouth, nose, or eyes before washing your hands. What are the prevent measures? Wash your hands with soap and water constantly. You will go to the doctor only in case of emergency. Coughing or sneezing into the inside of the elbow. And do not spread false news. It is possible to get COVID-19 from contact with a person who does not have any symptoms. The risk of getting COVID-19 from someone who does not have any symptoms is very low. However, many people who get COVID-19 have only mild symptoms. Therefore, it is possible to get COVID-19 from someone who, for example, only has a mild cough and doesn't feel sick. When should I go for medical attention? Well, a person should suspect COVID-19 when they have at least two of the following symptoms: cough, fever, or head check. And it is accompanied by one of the following: difficult breathing, sore throat, runny nose, red eyes, and muscular or joint pain. Is there a vaccine, medication, or treatment for COVID-19? Today, there is not vaccine or specific antiviral medication to prevent or treat COVID-19. How dangerous is the new coronavirus? As with other respiratory diseases, COVID-19 infection can cause mild symptoms such as sore throat, cough, and fever. Sometimes it can be more serious and cause pneumonia or breathing difficulties. Rarely, the disease can be fatal. How long does the virus causing COVID-19 infection survive and not survive? The SARS-CoV-2 virus can survive up to 72 hours on plastic and stainless steel surfaces such as kitchen tables, so it is important to clean and disinfect commonly used areas and objects. How long does it take from infection to the appearance of symptoms? Current estimates suggest that the time between infection and the appearance of symptoms varies between 1 and 12 days, with an estimate average of 5 and 6 days. It is estimated that the incubation period could be up to 14 days. Are antibiotics effective in preventing and treating COVID-19 infection? No. Antibiotics have no effect against virus, only bacterial infection. COVID-19 infection is caused by a virus and therefore antibiotics should not be used for prevention or treatment. What is the difference between COVID-19 disease and a cold or flu? The symptoms are similar, but the infection are caused by different viruses. Because of their similarities, it can be difficult to determine the disease from the symptoms alone. Therefore, laboratory confirmation is required if someone is infected with COVID-19. What disinfectants are recommended for cleaning? It is recommended to use household chloride for disinfection of surfaces and objects of common use and 70% ethyl alcohol to disinfect especially reusable equipment such as a thermometer. Can garlic prevent infection with the new coronavirus? No. Garlic is the healthy food, but there is no evidence that eating garlic will protect people from the new coronavirus. Can rinsing the nose with saline and gargle with mouthwash prevent the spread of the new coronavirus? No. There is no evidence that the practice protects people from getting the new coronavirus. Does the influenza vaccine also protect against the new coronavirus? No. The influenza vaccine does not protect against the new coronavirus, which is so new and different that you need your own vaccine. Although influenza vaccine is not effective for COVID-19, getting vaccine is highly recommended to protect your health. Can pets transmit COVID-19? No, there is no evidence that pets such as dogs or cats transmit or have been infected with COVID-19. Thank you for the attention and be safe.